This is an excerpt from an interview with Dr. Christian Kessler, who's a Western medical doctor as well as a scientist of Ayurveda who recently published a study showing that Ayurvedic treatment outperforms Western treatment for IBS. So I interviewed him and asked him about the Ayurvedic perspective on IBS. How is it caused and how should it be treated? I hope you enjoyed the video. What's the Ayurvedic view on IBS? How is it caused? How is it treated? And how does that differ from the Western view?
Mhm. Yeah, I mean, the fundamental difference is that from the perspective of Ayurveda, IBS is not so organ centric and not so focused on macro, micronutrients, etc. But the explanation happens more on a functional level. So in Ayurveda, two very relevant factors needs to be discussed when we talk about an Ayurvedic approach for what we call irritable bowel syndrome in the West. Of note, we do not always see 100% overlap between conventional diagnoses and traditional diagnoses. And that's a common misunderstanding, that we think, okay, it is called IBS in the West, and then there is a term in Ayurveda on Chinese medicine that is equivalent to IBS, sort of a Sanskrit word. And that's sometimes the case that we see very close approximations. For example, in osteoarthritis, there is a term called Sandhi-Gata vata, which relates well to osteoarthritis. But then there are different diseases where the overlap between diagnostic entities is not 100%. And that also relates
Mm-hmm.
to IBS. So we have to look at our patients, with the Ayurveda perspective. And that might give us different Ayurvedic diagnoses for people that would have the same Western diagnoses, for example, IBS, when they come to a conventional physician. So, and just to give you a few examples, from my perspective, and also in the Ayurvedic fraternity, when we talk about IBS, two things are almost always of relevance, and it's Agni, the principle of digestion and metabolism, and then the other big issue is a dysregulated functional principle that is called Vata dosha um, in Ayurveda. So usually one or the other, or in most cases both of them, both of these functional principles are dysregulated and need to be taken care of in a multimodality therapeutic approach. And but the constellation or the specific focus, what's more important in the individual case, might be quite different. And it might be that with one patient we work more on Agni, and with other patients we talk more about how we can regulate and then balance Vata driven process that is, responsible in that
Mm-hmm.
individual case for what the IBS patients experience per their symptoms. But nevertheless, Agni and Vata are almost always, a subject when we talk to our IBS patients. And
I see.
when we talk about Agni in IBS, it's usually a weak or an unstable Agni. So the digestive principle called Agni, and in Sanskrit, is usually not functioning well in IBS patients. And that's called Agni Mandya or Manda Agni,
Mm-hmm.
and that needs to be treated. And uh, and that can be treated well and then foremost with a individualized nutritional strategy where the target is to enhance the function and the capacity of our individual digestive capacity that is labeled Agni in Sanskrit and in Ayurveda.
I
So
see. So then the question is, I guess, for patients that want to incorporate Ayurveda into their treatment plan, do you have top three pieces of advice that they could take away if they don't
oh
necessarily
yeah,
have access to an Ayurvedic physician? What would you suggest?
yeah. There's the three biggest things that need to be considered are that IBS patients should prefer warm foods. So try to not have raw foods, salads, etc., cold foods, whatever that may be. So I prefer warm foods. Then the second key message for IBS patients when it comes to nutrition is adhere to a regular diet and try to install a rhythmic nutritional lifestyle. Yeah. So, and that helps the organism to get used to nutritional rhythms, and it's just easier for the organism to cope with whatever we eat when we adhere to a regular nutritional lifestyle. So regularity and rhythm is the number two. And the number three is prefer easy to digest, light, and freshly prepared foods. So take care that the quality of whatever you eat is maximized, and make sure that whatever you eat is light to digest. But that does not mean, that it's a low caloric food. But light to digest means is that you want to make sure that whatever you eat, is easy for the organism to digest. So warm, regular, and easy to digest. Those are the three major things to consider for IBS patients, and that will be communicated to each and every IBS patient that we see here in our department.
I see. Okay. Well, thank you for leaving us with some really good pieces of advice for people. I hope that people are able to hear that and take some value away from that.